am going to demonstrate the bedpan, okay? And as I'm doing it, I'll probably point out a few things, okay? Let's begin. Hi, McKenna. I'm Chris, your CNA. How are you today?
Good.
Good. Do you need to use the bedpan, I heard?
Really bad.
Really bad. Okay, I'm going to provide for privacy. I'm going to grab some gloves here. I'm going to raise the bed up for my height level, okay? But I'll be here. So as this is going up, I will tell those watching this video, please make sure you practice with both types of bedpans, because as a tester, I'm supposed to alternate between the two. So you need to be comfortable with whichever bedpan I tell you, okay? So I will, and before you begin, I'll, obviously in the scenario, I will tell you several things, including which bedpan to put her on, and one more thing when I get to it, okay? So here's your two bedpan choices, the standard or traditional, and the fractured. I'm going to use fractured on her today just because. The other thing I want you to know, the chucks, the linen protector, it's not in Headmaster's steps. I, as a former nurse in the hospital and long-term care, use these all the time because you spill urine once on your sheets, you'll never do that again. So it's optional if you use this, okay? But if you do, make sure the white side is up, okay? So also, here's the other point now, that in this scenario, that the instructor or the testing person is going to say she is able to wipe herself and she is able to lift her hips in order to place the bedpan. If you're not comfortable with that, or if this is like news to you and all you did was practice rolling side to side, that is fine too, okay? I am gonna have her raise her hips for this skill, okay? So that being said, McKenna, I'm gonna put the bedpan underneath you, and first I'm gonna put the chucks because. So if you would lift your hips, please, and that just gets centered underneath her. Okay, you can lower. And then the bedpan, make sure the buttocks goes here, the high end goes between the legs, okay? And the handle, we wouldn't want that under her back, that'd be quite painful. And these are not comfortable as is. So if you would please raise your hips again, and you place it, and maybe do you want to see how I placed it? So again, like so, and hips down for me. It's like that. And like I said, it is not comfortable regardless, but it's really uncomfortable if you have it backwards with a handle under your back, okay? I'm gonna raise your head a bit up. I if they can tolerate it, I think the higher up the better, just because when you're normally seated on a toilet, you're sitting straight up, you're not laying backwards. And I think it's hard enough to urinate in a bedpan as it is. Is that uncomfortable though? I mean, worse than usual? I kind of just want to make sure. So here's your toilet paper, dear, and here's your call light, and I want you to buzz me when you're done.
Okay.
Okay, on a side note, this is crazy because Headmaster tells you to keep your gloves on and keep the bed in the high position. I think it's all because it's timed. I don't know, we're going with that because that's crazy. Don't do that in the real world. Okay, buzz me when you're done. So you're gonna step off to the side. She's gonna go buzz. Okay, you're all done? All right. Let me just take this for a second to take this and throw your tissue in the garbage here. Let's wipe those hands quick, okay? So hands, we're doing a really quick job here, okay? All right, now I'm gonna lower that head of bed before I pull that bedpan out, okay? And then wait till I tell you, because I wanna get kind of a good grip on this so it doesn't spill. All right, honey, bend your knees for me, please, so I can see the bedpan. Okay, up. Thank you. Notice how I'm going to slide them up at the same time. Okay, are you doing okay?
Yep.
Okay. Now, chucks, if you used it, would go in the garbage. Okay, for now, do that. And this is when the testing lady will throw in some pretend urine. It'll be nice and yellow for you. Isn't that nice? Okay, so now I'm gonna measure. All right, now I have a urine pad under my graduate. I can do it right here, or I can take it into the bathroom. Either is acceptable. It is not acceptable to measure your urine on that overbed table. That's where food and water goes, so don't set it over there. Okay, I'm gonna carefully put this in, and then I'm going to squat because I have to read it at eye level. This is very realistic because it's more than 200 but less than 225, but you can be off by 25 mLs. So either go up or go down. I'm gonna say 200, okay? I'm gonna say 200. Now I'll be right back. Oh, no, I won't. I'll write this down. If you wanna zoom in a little bit, you don't have to write it right at this point, but I think it's on stepwise it does. Okay, on this lovely sheet that you signed, okay, where it says urinary output in milliliters, very important, I said 200, okay? So 200 milliliters, never ounces, okay? Now I'm gonna take my equipment over here and head into the bathroom. I still don't like her beds in the air. I could have lowered it at this point. Okay, urine goes into the toilet. We don't have a toilet, okay? We're gonna rinse. Rinse it out, dump in the toilet, rinse out your bedpan, and dump. And we're gonna dry our equipment. Doesn't have to be perfect. Again, it's a time test. Just go through and get it fairly decent. And drying, so I'm drying both of them. And I'm gonna put it back where I found everything. So this goes here, this goes here. I'm gonna take my gloves off and throw them away. I'm gonna definitely lower this bed. And how you doing, McKenna? Tired? Oh, she is tired. It's feel good to have an empty bladder. Yes. Oh yeah. Is it okay with your bed flat, or do you want it up a little, or you will perfect? It's perfect. Okay. Keep lowering until it stops, you guys. Here's your call light. Okay. Do you need anything?
Nope, I'm good.
All right. I'm just gonna go over to the sink and wash my hands. Okay.
Okay.
You have a good day. Okay, this scale, you have to wash your hands at the end. So I'm actually gonna take my watch off just because. Okay, turn on the water. Turn on both hot and cold so it's not freezing and it's not boiling, okay? Wet your hands, wet them first. A lot of students don't wet their hands, okay? Then grab your soap. I don't care how much soap is cheap. Even my boss said so, okay? I'm gonna scrub for 20 seconds using friction. Think clean to dirty. I'm gonna start at the wrists up here, and then the hands. Sometimes I sing a song to myself. Whatever you need to do, just don't rush it. This is how I go between fingers. Oh, this has gotta be close to 20 seconds. Then I'm gonna do fingernails like this. It doesn't specifically say that, but I'm an old nurse. That's how I was taught. So that's what I'm gonna do. Okay, now I'm gonna rinse one hand at a time, keeping my hands pointed downward so that soapy germs go down the drain. Don't flick, do the other hand. Hand pointed down. Do not touch the sink or the faucet, okay? Don't flick. Worst case scenario, real world, you accidentally touch it, you go, I touched it. I would normally start over and then ask the testing lady what she wants you to do. Chances are you acknowledge the mistake and you keep going, but it does depend on your testing lady. Notice how I have the water still running. Use as many towels as it takes, okay? You know, we're all different. But here's the thing, you want a clean, dry one, not a used one, to shut off the water. And then we did everything with her, so I think that's the end of our skill.